Let's talk about the ears. People often come in and they're not happy with their ears. There's 2 or 3 different things that can go on when somebody talks about they feel like the ears are prominent. One is the concho bowl, or the inside part of the ear. That part can stick out, creating the ear to be prominent. The second most common thing is a lack of a fold here. We have what we call the antihelical fold, which is this part of the ear. If that's not there, the ear can look very flat. It's often called an elf ear because it looks very flat. It doesn't have that natural fold. So the 2 most common things we're doing when we fix a prominent ear, or do what we call an otoplasty, is to make an incision on the back of the ear. And you want to first set the concho bowl, or set the main part of the ear back in, so that the structural part of the foundation of the ear is set back. Then if the cartilage here is lacking that fold, or if this part is still prominent, we're going to tuck that back as well, creating a nice, pretty contour to the ears. So you can still tuck your ears. They're not stuck back to your head, but you can still tuck your hair behind your ears, but they look nice and natural.